to report, and truly sadly, we have 5 additional deaths. The 5 deaths being reported today were all males between the ages of 45 and 82. We have seen 44 new deaths in Erie County since only September 1st. Of the prior 39 deaths before the 5 reported today, since September 1st, 51% of those were females, 49% were males, and they ranged in age from in their 30s to their 90s, with the average being 71 years old. 87% of those who passed away were white, 8% black, 2.5% American Indian, and 2.5% of an unknown race. 28% were vaccinated and 72%, almost 3/4, were unvaccinated. We continue to see a daily case count which averages over 100, and we are also averaging 5 to 6 deaths from COVID-19 each week here in Erie County. And in fact, there have been 18 deaths since I was with you just 2 weeks ago at this press briefing. We'll never fully be able to verbalize, the amount of grief that those who loved those 538 lives that we've lost are feeling. Lives who are no longer going to be with us, as we said, for our holidays, just for normal times, and to be part of our community. And we all know that the best way to prevent more deaths in Erie County is for everyone who is eligible to be vaccinated. Currently, here in Erie County, less than 52% of our total residents are fully vaccinated. So I again implore you to please look into vaccination and get vaccinated if you're able to. If not for yourself, then for the people that are around you, your parents, your grandparents, your children, your friends, your family, your coworker, and your neighbors. I'll also add, it's an important layer of protection to wear your mask. And we've talked about this a lot, but wearing your mask when you're indoors with people who live outside of your household gives both you and them protection if you're both wearing a mask. Distance when possible, and if you're feeling ill, please go and have a COVID test. And lastly, the booster shots. If you are eligible for a booster, please go get a booster to help protect yourself. And additionally, flu season is here. We have seen our first cases of flu here in Erie County, and it's important that all those who can also get a flu vaccine, as this is a double whammy hitting our community with the flu and COVID-19. Today, I'm really pleased to be joined by representatives from 4 of our medical centers here in the Erie region, and they're going to give us an update from the perspective of these regional medical experts. And we're going to start with Dr. Jason Chanold, who is the Senior Director of Emergency Hospitalist and Critical Care Services at UPMC Hammock. Dr. Chanold.
County Executive, thank you very much for inviting UPMC to speak today at the press conference. My name is Jason Chanold. I am the Senior Director of Emergency Hospitalist and Critical Care Services at UPMC Hammock. Today at Hammock, we are currently treating 49 COVID patients in our hospital, none of which are children. 8 of those COVID patients are currently requiring critical care and mechanical ventilation. Unfortunately, we continue to see the overwhelming majority of these folks being not vaccinated against COVID-19. We stress again, if you're not vaccinated, your risk of being hospitalized with COVID-19 is 30 times higher than someone who is vaccinated. Over the past several weeks here at Hammock, we've seen as many as 19 times more non-vaccinated patients ages 50 and younger being admitted to UPMC hospitals across Pennsylvania. So if you do get COVID-19, UPMC Hammock is here for you. However, our goal is really to keep you out of the hospital. We encourage you to call your primary care physician if you're having symptoms. Talk to them. Please don't come to the emergency department if you're just seeking COVID testing. As the county executive alluded to, there are plenty of places where collection centers in the community can help you in an outpatient setting without having to come to the emergency department. We continue to stress the best ways to prohibit getting COVID-19 is continuing to wear your mask, spacing, if you're sick, even if you're vaccinated or not vaccinated, staying at home, and getting tested promptly if you do experience COVID-19 symptoms. If you're positive, one option is monoclonal antibodies. UPMC has been the leader in monoclonal antibody treatment and highly effective outpatient treatment for COVID-positive patients. To date, we've administered over 8,400 monoclonal antibody treatments within the UPMC system. This treatment is very effective and is shown to prevent hospitalization and death by over 70%. And lastly, with updates to the CDC's guidance for additional doses and booster shots, we encourage people who are still considering to get a COVID-19 vaccine to please come and get your vaccine. There's plenty of availability all around our community. Being fully vaccinated dramatically lessens the risk of illness and hospitalization. UPMC HAMMOck continues to vaccinate all of our community members 12 and above. And we are now offering the booster doses to any eligible individuals as outlined by the CDC and the FDA. The quickest way to schedule an appointment is to go online to vaccine.upmc.com. You'll see all the information on who's eligible for those booster doses, and you'll be able to easily register for an appointment. We know that UPMC is also proactively preparing for the 5 to 11-year-old population that is in the news recently. We do expect as soon as that approval comes through that we will be able to vaccinate the 5 to 11-year-olds. And finally, in closing, our hospitals have been really overwhelmed lately with the volumes that we've been seeing, not only with COVID patients, but just general patients coming to our facilities for care. As you know, there's an ongoing staffing shortage of nurses and healthcare providers, and it does impact our capabilities and abilities to be able to treat patients. UPMC is in a better position than many others based on our size and resources, and we have the ability to help decompress our community hospitals, but we're all still stretched very thin. I would like to close on recognizing the amazing and resilient staff that we have here at UPMC HAMMOck and within our physician network. As we continue to fight the pandemic, we in the entire community continue to ask an incredible amount of our healthcare workers. Time after time, they step up. We simply could not have made it through the past year without this team's dedication to our hospital and providing compassionate and world-class care to our community. Thank you.
Thank you, Dr. Chanold. And now we'd like to have Dr. Boris Loza, the Chief of Staff at the Erie VA Medical Center, to say a few words. Dr. Loza?
There we go. All right, good. Thank you very much, County Executive Dahlkamper, for the kind invitation to give an update on what we're doing here at the Erie VA Hospital. And also thank you to our community partners who are taking care of our veterans who do have COVID-19, since we do not have an acute care COVID unit per se. I want to begin with an operational update in that our community living center, which is our nursing home, remains in the highest level, stage 1, due to the high community transmission rates. Unfortunately, visitation is limited to the CLCs, nursing homes, and there are restrictions on group gatherings. Routine testing is done of staff and residents per our protocols. Recently, 2 residents tested positive. That was earlier this month. We did open up an observational COVID unit, which was put in use until the 18th of this month. And it will be reopened if and when it is ever needed for any of our residents that test positive. And this is so our residents do not have to be transferred out to if they're not ill. Unfortunately, one of our residents who tested positive passed away. That patient was in hospice, and the other one was quarantined for the required time and safely returned to their regular setting. The next item would be the vaccine availability. Our hospital has always been a Moderna-centered hospital, as well as the Johnson & Johnson vaccine. The Moderna vaccine remains available to all veterans, and that includes spouses and caregivers of under the Saving Lives Act, which will not go away until this public health emergency remains that. So I just wanted to get that word out that spouses of veterans and their caregivers are welcome to receive their vaccines here at the Erie VA Medical Center. Currently, we are providing vaccinations at our main site and all of our community-based outpatient clinics. That's a Wednesday afternoon. I'll give a phone number out to any veteran, spouse, or caregiver who wishes to make an appointment. It is area code 814-868-8661. And then on the phone tree, press 2 to schedule an appointment. And this goes for COVID vaccinations and for our flu vaccine clinics, which are really in high swing, and I'll mention that in several moments. Now, there's the availability of boosters. As you may have been following in the news, the Moderna vaccine and the Johnson & Johnson vaccine have been approved for the booster shot. Now, we have been giving our Moderna dose number 3 for quite some time now, and it may be confusing even to a medical professional. The third COVID Moderna dose is different from the booster dose, and I'll explain why. Our Moderna number 3 availability, and we've been vaccinating, those are very high risk individuals who are immune compromised or have very, very significant medical comorbidities that make them very high risk. They are eligible for the full dose number 3, COVID number 3. The booster is for the other cohorts that make up our veteran population. And we are working through the particulars and the logistics of setting up our booster clinics. We expect that those will be operational within the next week or two. Veterans who do receive care here at the VA that are recommended for boosters will be identified through what we call our Veterans Outreach Tool. They'll be contacted by the medical center and their treatment teams and will be advised if they are recommended for the booster. Now, the purpose of the booster is to boost the antibody protection that is decreased over time from the original series of Moderna number 1 and Moderna number 2. In general, the next cohort of patients will be those that are age 65 plus or who are 18 years older and maybe in long-term care or have underlying medical conditions that are not as severe to warrant the number 3 full dose vaccine. And you have to be at least 6 months out from your initial series. Now, the Johnson & Johnson vaccine has also been approved for booster shots. The time requirement there is 2 months from your original shot. We do not have that offered currently here at the Erie VA, though we are working on plans, and we anticipate that that will be operational in the near future as well. There's also what we call a heterologous mix and match, additional points to the COVID-19 vaccines, and that means that if you receive the Pfizer series, your booster can be a Moderna. If you receive the Moderna, your booster could be the Pfizer, and if you received the Johnson & Johnson, you can have the booster, one of the 2 other mRNA vaccines. It gets a little bit confusing, but I think people will get used to the complexities as we move through the next weeks and months. Now, a little bit on vaccine status, just some of the numbers. We've given almost 22,000 total vaccines to our veterans since we started our vaccine clinics. This is approximately 61% of our veterans that we can identify that have been vaccinated, though this is a number that is sometimes difficult to pin down because the Definition of what a veteran is can vary depending on the databases that we research, but suffice it to say that our vaccine efforts are continuing. We've given 562 dose number 3s to our high-risk veterans. Approximately 94% of our nursing home residents are vaccinated, and approximately 80% of our staff is also fully vaccinated. In the federal government, as of October 18th, all VA healthcare employees were to be vaccinated, and anyone who is hired into the VA system as of November 22nd must also be fully vaccinated. Now, we do have veterans that are out there and maybe are listening. If you've been vaccinated outside of the VA and you want your treatment team to be aware of this so that we could have our records updated, you may send a picture of your official CDC vaccination record card to your VA care team via a secure message. And you also may add your vaccine information on our My Healthy Vet, which is the patient portal that's available on the internet. We encourage all veterans who may not have received their COVID-19 vaccines to reach out to their treatment teams. We are still administering our primary series of Moderna #1 and #2. So the invitation is always out. I encourage that highly for anyone who has not done that. And I want to thank all the veterans who have taken it upon themselves to receive vaccinations for protection of themselves, their families, their coworkers, etc. And just to reiterate that in our VA facilities, we continue with the remediation and the prevention. Masking is mandatory in all VA facilities, and I encourage masking outside in the community as well. And the final point I want to make is that the flu vaccine is also available. We have had very successful Saturday drive-through flu clinics. The next one is scheduled this upcoming Saturday, the 30th. Veterans may participate in that drive-through clinic at 8 o'clock until noon. That will be in the Erie VA Medical Center parking garage. No appointment is necessary. And bring your Form DD 214 if you're not already enrolled in VA care, and you will be able to receive the vaccine. We've had record-breaking participation in our flu clinics thus far compared to historical levels. So that is the update here at the Erie VA Medical Center.
Thank you, Dr. Loza. And now we're going to turn to Dr. Kevin Kraling. He is the Chief Medical Officer at Meadville Medical Center, and he's going to provide an update from Crawford County. Dr. Kraling.
Yes, thank you, County Executive Dahlkemper, for having us. Meadville Medical Center, I'm not sure if we participate in this call. This will be my first time, so again, thank you. Being that this is a regional issue, as you discussed, I second many of the remarks that the others have already made. We're feeling a very similar strain in multiple aspects. Our current status right now, as far as our COVID inpatient volume, we're averaging about 40 COVID inpatients over the past month. Currently, we have 33 COVID inpatients right now with 5 on ventilators. 80% of our inpatient COVID have not been vaccinated. So there's a big discrepancy between the vaccinated population and the unvaccinated population. We are also offering vaccination clinics, distribution clinics. We've had multiple over the past pandemic since this all started in December, as far as the availability of the Pfizer vaccine is what we use. Up to year to date, we're at 45,000 in vaccinations in the county. That includes first, second, and sometimes some third doses as well. In regards to the vaccine mandate, we're awaiting the details specific to the mandate in regards to healthcare workers, and we're going to act accordingly to comply once this timeline of potential exemptions have been issued. We do expect to hear more in the near future. Another thing vaccine related, the FDA Advisory Committee did approve the vaccine for the pediatric population. We do plan on offering that. We'll have more information on our website as in regards to the exact dates. Treatments that we provide here at the hospital, we are doing the monoclonal antibody infusion as well, smaller scale to what UPMC is doing, of course. We're averaging about 10 a day. That's led by our infectious disease doctor, Caroline Canisione. She's been doing a wonderful job spearheading that program. We also do have remdesivir available for inpatients. Our employee vaccination rate currently right now is at 70%. Volume and capacity, it sounds like a broken record. I know the emergency room volumes remain extremely high. We're kind of getting creative with space in regards to the department to help offload some of that volume. Our inpatient ICU remains at capacity, unfortunately. We continue to also experience the staffing challenges that other institutions are facing as well. In closing, I'd just like to really extend my sincere gratitude to the staff here at the Health Center. They have all done a wonderful job. There has been such great team effort to navigate this pandemic. It is Respiratory Care Week, so I'd like to especially acknowledge that team. Obviously, during a pandemic that affects the respiratory system, they're vital to getting us through this. So thank you very much.
Thank you, Dr. Kraling, and we are glad to have you with us today. It is actually the first time we've had Meadville Medical Center with us, and we know that this virus doesn't know boundaries and that we also have many listeners and viewers from Crawford County, so we do really appreciate you being with us. And finally, I'd like to introduce Dr. Daniel Muccio, who is the Chief Medical Officer at AHN St. Vincent Hospital. Dr. Muccio.
Good afternoon, everyone. Thank you, County Executive Dahlkemper, for the opportunity to report on our status at St. Vincent Hospital. Today, we are caring for 39 patients with COVID-19 infections. Of the 39, 1 is vaccinated and 38 are not. Unfortunately, 9 of those patients require ventilator support to breathe. All of our ventilated patients are unvaccinated. Our patients infected with coronavirus are cohorted on special units with negative airflow, and we currently have 3 COVID units. Pediatric cases continue to occur, although fortunately we do not have any pediatric patients hospitalized at the current time. While the number of COVID cases stress our operation, we continue to take care of all of our patients and manage the circumstances the best we can. Our operating room continues to schedule emergent, urgent, and elective cases. We continue to run vaccine clinics in the McGarvey Learning Center at the hospital. Initial doses as well as booster doses are available in that clinic. In addition, we also provide vaccine at 15 different outpatient locations, including most AHN PCP offices and the AHN Cancer Center. We offer all 3 vaccine products, Pfizer, Moderna, and Johnson & Johnson at this time. We are following the CDC guidelines on who is to receive a booster. To schedule, please visit ahn.org, call 814-CONNECT, or contact your AHN PCP. We will begin offering the Pfizer 5 to 11 vaccine to children once the appropriate FDA and CDC approvals are issued. We plan to hold separate vaccination clinics for this patient population. We anticipate offering the vaccination at our Family Medical Center, as well as at both our East Side and West Side pavilions. We also anticipate holding mass clinics in our McGarvey Learning Center. Further announcements will be forthcoming after the final approval is received. We are providing boosters to our employees. We're administering the flu vaccine at the same time, and that it's safe to receive both vaccinations simultaneously. Receiving the COVID vaccine is an expectation for our employees at AHN St. Vincent, but is not a condition of employment at this time. We continue to deliver monoclonal antibodies for those that qualify in our special infusion clinic. Patients are referred for this infusion by their PCP or the emergency department. And this treatment has been very successful in reducing hospitalizations for COVID. We continue to work collaboratively with all of the regional health systems. I participate on the regional chief medical officer calls where our local hospitals share and discuss best practices. And thank you for the opportunity to speak this afternoon.
Thank you so much, Dr. Muccio, and thanks to each of our physicians who are with us today. I'm going to now turn to the media for questions, and I want to let you know that Melissa Lyon, the Director of the Department of Health, is also with us today to answer questions. And today we're going to start with JET TV.
Good afternoon, County Executive Scott Bremner here. I'd like to ask either you or Melissa, what is your, and I understand nobody's got a crystal ball, but what do you think the impact is going to be once it appears that the 5 to 11-year-old group is going to be starting to get online in terms of the overall picture, in terms of the fight in Erie County when you have an additional group of people, albeit younger ones, that are going to be getting their shots?
So we know that we have just about 52% of our population vaccinated, and of course that includes our children who are not eligible at this point. So any group that we can add to that list that can get the vaccine, I think will be very helpful. I know of many parents who are anxious to get their child vaccinated, and we're also seeing that we're seeing a large number of positives within the pediatric population, but we're also seeing it in the populations that would represent the parents of those pediatric patients, and then of course that eventually can go up to be the grandparents and the people that are much more susceptible to the really ravages of this virus. So we are looking forward to that approval happening, and to the fact that there are numerous parents who will feel much better after they get their child vaccinated, for their child's sake and for the family's sake overall. And I'll ask Melissa Lyon if she would like to add anything to that.
Thank you, County Executive. You've done a really nice job summarizing what we've discussed in our meetings around the excitement we have that pediatric individuals would be eligible for vaccinations. The only thing I would add is once we have more children vaccinated in that population, it's going to be another level where we can interrupt the spread of the virus. So the more that we have vaccinated, the more places that we're going to interrupt that spread. So we're really looking forward to that, and those that are willing to vaccinate their children. Thank you. Back to you, County Executive.
Thank you. I will go to Joel at Talk Erie.
Thank you, County Executive. Appreciate that. I do have a question for Dr. Chanold from UPMC. Been reading about what's happening in places like Lansing, Michigan, Dr. Chanold, where basically the emergency department is overwhelmed. What are the chances that one of my listeners who would need emergency services in the ED, that they would be able to get a room at UPMC and not end up in the hallways?
Well, thank you for that question. Obviously this is top of mind for us. Every day our team here of physicians, administrators are working to make sure that we have the capacity to handle and take care of our patients. We continue to stand ready to take care of our patients. We put a lot of different efforts into place at using alternative care locations to make sure if something like that were to happen, we would be able to take care of all patients coming in. We are the regional tertiary care center, so we do get a lot of transfers. And one of the things that we've been also looking to do is help decompress some of our community hospitals. So it's very important to maintain that communication and working with all of our regional hospitals to be able to take care of the patients. But I think it would be very unlikely that we would be able to not take care of a patient who presented here.
So just so I understand, UPMC has the opportunity or the ability to surge more ER rooms, much like they can with the ICU rooms.
Yes, we do have processes in place to surge up if we need to for ED, ICU, and just our normal medical surge units. So, yes, correct.
Thank you. Appreciate it.
Thank you. We'll go to David with the Erie Times News.
Hi, Kathy. Thanks. This question's for you. I want to get an update on the efforts to get the county employees vaccinated. What are the current number? How many folks have received the $300 incentive for getting vaccinated? Can you give an update to that?
Sure. I have those numbers here. We, in the first wave, which was the last paycheck in August, we had 850 employees who had submitted their vaccination records and received that $300 payment. And since then, we've had 142 additional employees who've submitted their records, which takes us to a little over 72% of our employees who are fully vaccinated that have at least turned their cards in. We do believe there are some individuals who decided not to turn the cards in because they did not want the $300, but we don't know who they are because, of course, we can't ask that question.
Okay. And to follow up on that, I know we had a previous story at the beginning of this that there were roughly about 900 county employees who were vaccinated when the incentive was announced. And what you're telling me, just correct me if my numbers are off on this, that you have about 992 about it. Do I have those numbers right?
No.
So is there about an increase of about 92 since the incentive was announced?
No, we would have had less than, we had 850 employees who got the $300 in the first group that went out. So we definitely had less than that when we started. I don't know what that number is. I'd have to go back and look at the records, but it was much less than that. We had asked if they wanted to, at that point, that's when the numbers were very low, we were saying they didn't have to wear a mask if they were fully vaccinated while they were at work. We've, of course, since changed that as the virus has ramped up again. And so we had many, many less than 800 who, or 900, whatever number you put out there, who had actually turned their cards in at that point. But I would have to go back to my HR department to know what that number was. But one of the things we probably haven't talked enough about, and it hasn't been written enough and talked about enough in the media, is the fact that in the first quarter of this year, we had a number of hospitalizations of our employees, which resulted in about $500,000 that was charged to the county's self-funded health plan. That directly hits the taxpayers of this community. And every individual that I can keep out of the hospital that's a county employee not only obviously benefits that exact person, but it actually helps the bottom line of the county budget because it's obviously very expensive for someone to have to go into the hospital for care. So we believe that this has been a really fiscally sound thing to do, and it has resulted in probably 150 or more employees getting vaccinated since the incentive was announced, and we still have people turning their cards in as we speak. So we will have this available till the end of the year, and I believe it is saving lives, as well as we have a very, very strong masking policy within all county buildings, as anyone who's come into the county buildings knows that we have.
So just to be clear, Kathy, if you can, what's the total number of employees who have handed in vaccine cards and have been compensated for this?
992.
992. Okay. All right. Thank you.
Okay, sure. We'll go now to Erie News Now.
Hi, Kathy, if you had a crystal ball, no, I'm kidding. Question for Dr. Kraling. Doctor, you talked about having to get creative with space in the emergency room. Can you elaborate on that a little bit and talk about what you've had to do to accommodate patients during this surge of the virus?
Sure. In the emergency room right now, we're working in conjunction with our OR team. So there is a space right next to the ER called the PACU, or the Post-Anesthesia Care Unit. And what we're doing, instead of the OR patients going to that unit, they're moving over to a different unit in the hospital that's a little larger for the OR. And then we're utilizing the PACU beds for the emergency department hold patients that are awaiting transfer up to the floors. Sometimes we do run a fast track through there, so some of the lower acuity patients will be seen there and discharged from the emergency department. The other thing we just had installed today was a fairly large trailer outside of the emergency department. We're in the process of hooking that up to utilities, as well as getting the appropriate infrastructure in there as far as connectivity and Wi-Fi and all that. What we're going to use that is as a ER holding area. So what you're going to see is, if you walk into our door to be seen for care, you're going to be triaged. You're going to have a medical screening exam performed. And then this is very low acuity patients. So these are patients that aren't in any acute medical distress whatsoever. Say they're there for a sprained ankle or something, an earache or something simple like that. So they'll get whatever testing they need done. Say they need an x-ray for that ankle, and then they'll go out into the, we're going to call it the results pending area, and wait with a provider out there evaluating them again, and some support staff, RN, LPN, or medical assistant out there. And the reason for that is we really wanted to debulk our waiting room. We only have 20 beds back in the emergency department, so whenever things would get full, the waiting room would back up. And obviously in this day and age, we all want to social distance. So that's the reason for adding the extra space there.
Doctor, a quick follow-up. When you're at the point of bringing in a trailer to accommodate patients, safe to say that this is the worst it's been down there?
I've been in the emergency department since 2006. That's initially where I started my career. I've just been doing this job since July. But I've never seen it like this. Never seen it like this. And I can't echo the sentiments that have been said before. This vaccination is saving lives. 80%, like I mentioned, of our patients that are in the hospital are unvaccinated. 20% are. There's going to be some breakthrough cases. It's like that with any vaccine. But I'll tell you, the sicker, the more acute patients that are landing in the ICU, that are on ventilators, predominantly they are unvaccinated patients. Our vaccinated ones that end up here, unfortunately having to be admitted due to their illness, they usually have a lot of other medical comorbidities going on, whether or not they're immunocompromised for whatever reason, or they have diabetes, or they have a bunch of other health conditions. So I hope that answers your question.
It does, and very quickly, just how frustrated does it make you? We have 3 vaccines and you're staging people in a trailer. Where's your level of frustration that it's come to that?
I think it's up there.
Thank you.
Thanks.
You. And now we'll go back to Scott at Jet TV.
Hey, Kathy or Melissa, I guess either one of you, given the situation that no one had looked at, you know, the fact that there was going to be another round here and what have happened, and as you kind of review and look back over how things have progressed, generally speaking, are you happy with the response that the county has done? Are you concerned that you know, some of those dire predictions about the number of beds that will be needed? I mean, how bad kind of is that situation in the big picture? It's hard for us to get are we 30% of our capacity? Are we 90% of our capacity? How concerned should we be about the resources that are being used and our response, given the fact that, you know, that there's been another round and things have gotten worse?
So I'm going to let Director Lyon take that as she has many more conversations with our partners on a weekly basis. Melissa?
Thanks, County Executive, and thank you for the question. I'm going to take this in kind of 2 parts. You asked about the response of the county and do I think there's more we could have done or have we done everything we can? And I'll be honest, you know, all of the mechanisms that we need to get through this pandemic are available. They're widely available. Access to vaccine and knowing that masking indoors, universal masking also stops the spread of virus. This is our protection methods. This is what we have, and it's widely available. So is there more that we could do or could have done? I think at this point, a lot of the results lay within the community. So I'll say that. I'm here to support those efforts. I know everyone on today's call is here to support those efforts. You have healthcare systems that believe in the public health mitigation measures that we need to get through this pandemic. And so as we've met to talk about what the capacity looks like, I rely on the experts in the health systems to let me know what that looks like. And you've got to hear from them today directly that they are able to provide the care. They are able to handle what's happening. However, I think I will speak on behalf of them. They're in uncomfortable positions because of staffing shortages. They are uncomfortable with the concepts that 80%, as you've heard, are unvaccinated. Those are preventable hospitalizations if we have vaccines widely available and people are willing to take the vaccine. So it's not an easy question that you've asked me, and I hope that my response has been felt very honest in what I'm saying is that there's not more that we can do as a hospital. There's not more that we can do as a public health agency. We all have to work together to get through this. Vaccine is widely available and masks are widely available as well. And if you heard a lot of background banging, I'm not sure what's going on in the heating system, but that's a distraction as well. So I thank you for the question, and County Executive, feel free to add anything additional that you would like.
No, the only additional thing I'll add is I continue to be amazed at the people who are on the front lines of this, both in the health department and in our medical facilities. Many spoke to that today, but I think this community, if you see any of those people, they truly are our health heroes, and I ask you to thank them for what they're all doing continually now for about 20 months. Now I'm going to turn over to Joel at Talk Erie.
Yes, thank you, County Executive. I do have a question for Dr. Muccio from AHN. Doctor, what are you hearing? What are the major complaints that are being presented by acute care personnel, nurses, and so on, techs, about conditions in their area?
I mean, the number one concern that they have and that we have is really with staffing. We have, it's never been a physical space issue. We have plenty of space for more patients. It's a matter of staffing the hospital. And so, that's where the stress is. We're asking our nurses to do a lot more. We're asking them to work extra shifts. And so that's the number one complaint is just the volume of work and the staffing constraints that we're up against.
Was there a shortage of staff going into the pandemic that this has been exacerbated by, or is this all because of the conditions on the ground with COVID?
I mean, there's always been talk of a nursing shortage. So I think everybody was running a little lean at the beginning of this. But what you've seen now, particularly in nursing, is really a major labor market disruption because nurses are traveling. What would happen is a hotspot would break out. They would need nurses. They would offer premium wages to nurses. And then nurses would leave your facility, travel to other parts of the country, and deservedly earn very high salaries. And so now just about every hospital in the country is staffed with a lot of traveling nurses. So for example, us, a third of our workforce right now is what you'd call travel nurses, nurses who were not our nurses at the beginning of this, but nurses that have come from elsewhere. I mean, I have nurses from UPMC Presby, from Shadyside, from other parts of the country. And what's happened now is within our own market, we're all hiring traveling nurses. So I have traveling nurses that are Hammett nurses, and Hammett has traveling nurses that are St. Vincent nurses. So we're really swapping nursing staffs in order to staff our hospital. So that's been the big change, is that the nursing capacity has basically started to move around the country depending on where the hotspots are. I mean, that would be the one optimistic point I would say, is that as these other parts of the country are winding down and coming out of their surges, if we were to enter a bigger surge and really be stressed, I think we would recruit traveling nurses from other parts of the country. Because again, it's all about staffing beds. I mean, a hospital bed without a nurse is a hotel room. It's not a hospital bed. So like I said, we have space. We've actually at different surge times, using the waiver from the state, our hospital used to be all double occupancy, and we converted to private rooms a few years back. We've reinstituted some double occupancy beds on certain units if we've been stressed. So we've got physical space. It's just a matter of recruiting enough nurses and respiratory therapists and people like that to take care of them.
Thanks for that explanation. Appreciate it.
David, Erie Times News.
Yes, Kathy, thank you. This question is back to Dr. Kraling. Dr. Kraling, you mentioned the effect of this increase in patients in the emergency department. You also mentioned the ICU is at capacity. Can you elaborate a little bit on that? What does that mean when you have new critically ill patients that need ICU level care? Are they being transferred to Hammett and Vincent? Take me through a little bit more detail what's going on with your ICU.
Unfortunately, transfer up to Erie really isn't on the table for a lot of the patients right now because they're also experiencing the same issue that we are. So what we've done to their ICU is ordinarily we have a 14-bed unit. We've now instituted an overflow section out to the unit next to it. So that'll increase our ICU capacity to 3 or 4 more beds to that area. Thankfully, when I say our ICU is at capacity, the physical ICU is, but we do have kind of the nuclear option of utilizing the extra rooms if we need to. So right now we haven't had anybody who's needed an ICU bed in Meadville has been able to get one. If it gets to the point where we're significantly backed up, then that patient will remain in our emergency department, and because that is the other aspect of acute care in the facility, location of acute care.
And to just kind of get to some of the reasons of this, I mean, we're seeing a lot of cases in Erie County, but the rate of hospitalized COVID patients in Crawford County is much higher, according to the State Department of Health. Why do you think that is? Why is this right now hitting at a much higher rate in Crawford County than it is in Erie County?
I'm not 100% sure of what the Crawford County or Erie County vaccination rate is. I know ours is 53%. County Executive, could you comment on that? You happen to have that information?
Yes, ours for total population, including the children, is 52%. I don't know if you're talking about eligible or not, but ours is at 52%.
Yeah. Including children?
Mm-hmm.
Okay. Yeah, ours is around 52, 53%. I think our community as a whole perhaps does not mask as well as some others might. That might be playing a factor. I'm not sure why we're getting so hit. The number volume thing might be different too. St. Vincent and Hammond have a higher capacity to admit a lot more patients, and our capacity to admit patients, of course, for a lot smaller hospitals, everybody knows that. So that might be skewing the numbers as well.
Thank you.
Thank you. And we'll have a final question from Erie News Now.
Hi, a question for Drs. Muccio, Kraling, and Chanold. Just quickly, at what point do you have to consider doing away with any elective surgeries, so-called elective surgeries, just because of staffing shortages, rather? How close are your respective hospitals to that?
First, Dr. Chanold.
Thanks for the question. Obviously that is a consideration that we look at on a daily basis. We would always do the right thing if it gets to the point where we would need to look at our surgical schedules. We would definitely to make those changes. But right now, I do not think we're at that point where we do need to modify. Obviously we're stretched very thin, but you've seen this pandemic offer, prolonging of care. So while people look at the surgical saying that, cancel these surgeries, a lot of people need these surgeries. People put these surgeries off. We're experiencing something we've never seen before. It's not only COVID, but it's our normal volume as well. Patients have prolonged their care. So we, at all efforts, want to keep that going to make sure that patients are getting the best care possible. But we do consider it. It's not currently being implemented at Hammond, though.
Similarly, down here in Meadville, we had to cancel some elective cases, and that's done we evaluate that every day, whether or not we need to do that or not. We absolutely try our hardest not to do that. There has been a couple instances where we were canceling a few cases here and there. Kind of, again, trying to get creative. We have 2 campuses here in Meadville, Liberty Street and Grove Street, so we have opened up our rehab unit to some post-op patients as well, so that's expanding our ability to care for patients and get these surgeries done.
Yeah, Vincent, early on in this surge, the beginning of September, we had to reschedule some non-urgent surgeries. But then we instituted a CAP program where we monitor the number of surgical cases that are going to require beds post-operatively. And because those are the ones you really care about. If you can convert a surgery to a same-day surgery, it's really not an issue. It's those people that need to stay in the hospital post-op. And so what we've been doing is monitoring the number of cases per day that are going to need a bed, and then we have a cap. And so once we hit that number, if a surgeon calls to book a case and it's not urgent, we'll say, well, that day's no good, pick another. And so we're getting better at spreading our schedule out, avoiding the peaks and valleys, and maintaining our ability to continue to schedule these surgeries. And so what we would probably do is if the numbers increase, we'll lower the cap, but we won't just suspend elective surgery. The other thing my surgeons have gotten really good at is converting these overnight hospitalization type patients into same-day surgery. So our orthopedists have done a wonderful job at doing a lot of same-day joints. Historically, joint operations, well, they used to stay a few days. Now it's like an overnight stay. We've been using this medication called Exparel, which is a long-acting anesthetic. And so what you do is you can inject that medication at the surgical site and provide long-acting analgesia, which then enables you to get the patient out of the hospital. I'm a neurosurgeon. We've been doing a lot more same-day lumbar disc surgery. So we're converting a lot of surgeries that used to stay overnight into same-day surgeries successfully by using a long-acting anesthetic medication, as well as just setting that expectation with patients ahead of time that we're going to send you home the same day, unless, of course, you're not feeling up to it. You have to be able to walk okay, pain under control, voiding okay, tolerating oral liquids and that sort of thing. So, we have our criteria, but we're converting a lot of these same-day overnight admissions into same-day surgeries, capping the schedule overall. And since early September, have managed not to cancel any non-urgent or elective surgeries. And I would expect that to continue. We can tolerate more numbers COVID-wise than we have now without doing that.
Thank you so much. I want to thank our 4 physicians for joining us today. I think it was really helpful for everyone to hear from all of you, and I appreciate always Director Lyon being with us. And in closing, just ask you to do what you need to do to keep yourselves, your loved ones, and especially this community, our youngest children and the most vulnerable safe. Please get vaccinated if you're not. Wear a mask when you're indoors with other people who don't live in your home with you. And if you're feeling ill, please stay home. And if you have symptoms, go get tested for COVID.